A sobering report shows just how dangerous the COVID-19 pandemic has been to our mental health.
The Centers for Disease Control says 40% of adults in the U.S. have faced at least one mental health challenge in the last 5 months, leading to substance abuse or suicide. WCCO's Liz Collin shares how one young man battled his addiction and the advice experts have to get us back on track.
I was pretty young when I got into it.
Justin Gaiman was just 15 when he started using heroin. It took him 3 years and 10 treatment centers to get clean.
I realized you are who you hang out with, so I realized I needed to find a new environment to put myself in.
Lately, with ongoing lockdowns, criminal justice, and political turmoil, he knows deep feelings can have dangerous consequences.
And I just feel like you don't have to look too far to see how addiction and the rise in overdose deaths go kind of hand in hand with the conversations being had.
There's a lot of anxiety. There's depression.
As executive director of NAMI Minnesota, Sue Abderholden has watched mental illness issues rise for 5 months. The CDC says 1 in 10 adults had serious thoughts of suicide. 25% of people ages 18 to 24 had. And more than 20% of essential workers said the same thing.
Whether it's in a nursing home or in a hospital, even a grocery store, you're coming into constant contact with people, and that can really increase your anxiety, frankly, about the future.
Abderholden says more people are finally seeking help.
As we hit that 3-month mark, I think people just frankly couldn't keep it together anymore.
Telehealth and socially distanced meetings in parks and parking lots have provided some relief. Abderholden also suggests staying away from alcohol and sticking to a routine. Believing grace and space will go a long way, like they did for Gaiman, living a sober life for the last 6 years.
We just got to be there for one another. I think that's probably the most important thing to share.
Liz Collin, WCCO 4 News.
Help is always available 24 hours a day, 7 days a week. You can call 1-800-273-8255. Or if you prefer the text, the number is 741-741. We also have more resources regarding mental health on WCCO.com.